The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, My Bariatric Solutions features their mobile lap band unit to help patients with their follow-up lap band appointments. Orthopedic surgeon Dr. Charles Tolson discusses the benefit of a double hip replacement. Interventional cardiologist Dr. Annie Varicose talks about cardiomyopathy. Vein specialist Dr. Peter Morgan talks about varicose veins.
For numerous years I've had varicose veins. I'm a registered nurse, and so I have been on my feet for 20 years, and also heredity has played into that. And so just a lot of varicosities and some pain, aching if I've been standing on my feet for a long period of time, and then just unsightliness.
Varicose veins are a symptom. They're a sign of an underlying disease or abnormality in the venous circulation. In your legs, there is no heart to pump the used blood back up, and so the pumps are your muscles. And when the veins become too large and one-way check valves have failed, now all the pumping doesn't work and the blood pools in the legs. It creates high pressure, which results in bulging, enlarged veins that we call varicose veins.
My dermatologist recommended Dr. Morgan, and he was very forthcoming with information. It wasn't a lot of extraneous things that I didn't understand. It was very to the point, exactly what he could do for me, and what the benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Deep breathing can help you relax, but that dose of oxygen will also make you feel happier and more alert. Practice this by taking deep breaths, sucking air in through your nose until your lungs are full.
Initially, we had a lot of trouble getting patients that were from outlying areas taken care of as far as their adjustments for their bands.
When you adjust a lap band, what you're doing is you're accessing the port, which is located in your abdomen area, and you put saline in it, and it blows it up just like you would an inner tube. As the food goes into the stomach, in that, which we call the pouch, it has receptors, and with those receptors is what triggers to the brain that you're full. And by the lap band restricting and holding that food in that area, you will get a full feeling much quicker than what you would normally.
We had a fluoro machine because we do all of our adjustments with an x-ray machine, and those were extremely expensive, and I had to figure out a way to get those to the patients. At that point, we decided to put that in a mobile unit, or we call it a lap band wagon, to do adjustments for patients on site or at least in their area.
This is where we do the actual follow-up appointments and also do the fluoroscopy on the patients to make sure that their band is working and to see how much their band may need to be adjusted.
The fluoroscopy machine is like a live video. They drink barium. It allows us to actually visualize it going down the esophagus, in through the lap band and into the stomach. This gives us an idea of how everything is working inside.
It's just as sanitary, just as sterile. We use the same procedures as if we were in the emergency room or in the office.
Because follow-ups are so important to our patients' success, we've made it possible now for all patients, regardless of the type of procedure that they've had, to be able to do their follow-ups on board the lap bandwagon, which makes it beneficial for the ones in Abilene, Amarillo, Waco, the different locations that we drive to. But we are the only practice in the country that has a mobile unit, and we're really proud to have this.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Find your doctor on bestdocsnetwork.com.
I had gone from such an active lifestyle to a life of where sitting, standing, sleeping, trying to turn, trying to walk, getting up off the sofa was a major ordeal for me. Any kind of movement or non-movement was excruciating.
Brenda is in her 60s. She came to me because she had severe arthritis in both of her hips. She had seen other doctors. One doctor prescribed injections, but they only lasted a few days. So we found that she was indicated for bilateral hip replacement because she had severe arthritis in both hips.
After an examination, he goes, I have good news and I have bad news. And he says, well, the bad news is both of your hips are in really bad shape. He says, you're gonna have to have the bilateral hip replacement. The good news is, I can do it, and I'm happy to do it. Dr. Tolson also had a model of the hip, and he said, this is what the procedure's gonna look like. And he talked through the whole thing, and he says, you're gonna be a new person once you have these hips in.
It takes about 6 to 8 weeks for a patient to recover from hip replacement. But when you do both at the same time, it literally takes about the same amount of time for them to recover. This in particular makes bilateral hip replacement an ideal surgery when you have the perfect candidate. Because Brenda was very healthy, we were able to accomplish both hip replacements in one setting.
After surgery, I woke up and I cannot begin to tell you how wonderful it was. I was without the pain that I'd had over 2 years.
Brenda is doing amazingly well. She is just so happy and happy with life. She walks 3 to 4 miles a day. She has no pain. She's able to do everything she wants to do in her life, and we're extremely happy with her outcome.
I just cannot thank Dr. Tolson enough for giving me back my life. It's truly a gift, and I will be forever grateful.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Start sprinkling your oatmeal with some cinnamon. Studies show that this antioxidant-rich spice may reduce blood pressure and lower stress.
So John is a wonderful man. He is a father, he works every day, but unfortunately he developed coronary disease at an early age, weakening of the heart because of that. So when he presented to me, the heart function was very poor.
I was a jock, watching my diet. I loved exercise. I ran marathons. I was an NCAA certified basketball and football official. And the people that I work with, they knew me and knew that I was a fairly healthy person. So when they found out I had a heart attack, everyone was floored.
Heart failure means the heart becomes weak, whether it's because of blockages or other things. Viral illnesses can cause heart failure. But for him, it was blockage, not getting enough blood, so the muscle became weak over time.
Before I started seeing her, they wanted me to run through a battery of tests. And when she saw the results of those tests, and I believe she was on maternity leave at the time, she came in and wanted to see me. And it was at that point she actually brought up that somewhere down the road I may actually need a heart transplant.
Over the years he's been evaluated by the transplant team, and he didn't need a transplant because we had taken great care of him, and he's very thankful for that, and I'm thankful for medications and therapies that we were able to give him to keep him really controlled on heart failure.
Dr. V is an amazing person. I owe quite a bit to that woman, and I feel very fortunate that she's my cardiologist.
He did have a device, a shock box put in, so that in the event of an arrhythmia, because the vessels are not working and the muscles not working, so electrical abnormalities can occur, and people can have sudden death from heart failure. So we protected him by putting a shock box. And he has been able to work every day, but he takes his medicines and he's doing great. So that's a great testament to having great doctors paired together and great institutions to take care of patients. And we're very blessed here in Texas because of the Texas Heart Institute.
Request an appointment on bestdocsnetwork.com. Coming up on the second half of today's show, facial plastic surgeon Dr. Yadro Ducic discusses the importance of good skincare for his patients. Houston Northwest Medical Center features its breast center. Oral surgeon Dr. Paul Metz reconstructs his patient's jaw. Craniofacial and plastic surgeon Dr. David Jenikov talks about his approach to facial rejuvenation with his patients.
And we are excited to have in the Best Docs Network studio Dr. David Jenikov. He is the owner and director of the Jenikov Plastic Surgery Group, one of the best plastic surgeons in the state of Texas, and operates right here in the Dallas-Fort Worth area. Dr. Jenikov, welcome to the program.
Thank you, Jim.
All right, let's get right to it. If I come into your place, anyone else come into your place, they want to look younger. There's no doubt about it. So if you're consulting with an individual and they come in and say, hey, I want cosmetic facial plastic surgery, what do you do?
Well, anybody that comes to the office is really kind of unhappy with something about themselves. And usually when they come in with an issue about their face, we get comments like, I now have my grandmother's neck, or I look just like my dad, or I'm out there trying to get a job and I'm competing with people that are 20 years younger than me and I look 30 years older than them. How do I get back to a more competitive position? And so we start to talk to them. I talk to them about what their goals are. And so sometimes they think they just want surgery, when in actuality they don't really need surgery at all. They could use some non-surgical treatments with injections or fillers, or even some skin therapy. And those kinds of things will highlight some of the patients just enough so it'll get them where they need to go. Additionally, if they do need surgery, we do a full physical examination and really try to find out what it is that is bothering them. And so it's that detailed conversation with the patient at the very beginning that helps guide what kind of treatment that they're going to get.
Okay, now for an individual that comes into your practice and says, I just want to look better, what do you tell them?
Well, I have them look in the mirror, and that's where it all starts. We put them in front of a mirror and say, what is it that you see that you'd like to change? And so we address the eyes and the nose, the area around the mouth, and the jowl and the neck, and we look at each one of those, and then I begin to kind of move things around for them and show them what it looks like, what the options can be.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
For more information on this doctor, call now or go to bestdocsnetwork.com. Request an appointment on bestdocsnetwork.com.
Here at Houston Northwest Medical Center's Breast Center, we focus on the patient and giving them the best quality care possible. The Breast Center here at Houston Northwest is a comprehensive breast center, meaning that not only can we do screening mammograms, we can also do the diagnostic portion, ultrasounds, MRIs, and biopsies.
I'm currently the medical director at Houston Northwest Medical Center. My primary role is interpreting screening and diagnostic mammograms, breast ultrasound, and breast MRI for detection of breast cancer. Also to determine clinical issues. If a patient comes in with a palpable lump, we want to find out what it is. Doesn't mean it's going to be breast cancer. It may be a simple cyst, it may be a benign tumor, but that is part of the workup that I'm involved in.
All of our nurses are certified nurse navigators here. They help the patient walk through the system, whether it's just for a screening mammogram or all the way through surgery. They help them navigate their care.
At Houston Northwest Medical Center, we have 4 breast patient navigators. We are very fortunate to be able to do what we do. Very few hospitals in the area have the opportunity to have this many nurse navigators, and from the beginning, from screening, from going out into the community, it's all about deliverance of care and continuity of care. So if you just make sure that that care is not broken, then one passes a torch to the next person to make sure from the time that she got her biopsy, from the time that she got her diagnosis, that we actually use the library to give her all the information that she needs to arm herself before she goes to see the surgeon.
At Houston Northwest Medical Center, we're very fortunate that we have a multidisciplinary breast cancer conference every 2 weeks, so twice a month. Every patient that is diagnosed with breast cancer at this hospital will be presented at a conference that is attended by radiologists, pathologists, breast surgeons, oncologists, radiation oncologists, and plastic surgeons, and the nurse navigators.
This is an excellent way for the patient that has been recently diagnosed have a treatment plan mapped out for her by specialists that come to the breast conference.
The Breast Center at Houston Northwest Medical Center is the only certified center of excellence in Houston, Texas. We have a monthly support group called Care, Share, and Be Aware, where newly diagnosed patients can come and share their feelings. They can also bond with other breast cancer survivors to interact with them and learn from them.
We always say no one chose this journey, but if you're walking the journey, you're not going to walk it alone, because we're going to walk it with you.
Find your doctor on bestdocsnetwork.com.
Another reason to stay hydrated throughout the day is because your brain is composed of 75% water. Your brain will also begin shrinking 0.25% in mass each year after the age of 30.
So before I met Dr. Duchik, I just felt like my skin was dull and spotty and splotchy, and was constantly trying to search for makeups that would make a difference transitioning into my 50s.
Skincare is obviously very, very important. The skin is what everybody sees.
They don't see the underlying bone. If we do somebody's rhinoplasty, they're not looking at their cartilages, they're not looking at their jaws, their cheekbones, their eye sockets. They see the skin. That's the first thing that you see. So ideally, you want the skin to look as good as possible.
Typically, Dr. Duchik does like me to see patients before they have surgery. He'll do a consultation and he'll send me in the room and say, please talk to them about skincare. Let's get their skin looking good first, and then we'll, discuss surgery.
I always feel at home with Jennifer. She is a very well-versed in skincare, and she pays attention to my age, and we stay really focused on what it is that I'm trying to accomplish.
Well, the whole point of doing cosmetic surgery on somebody is to make them look better and feel better about the way they look and more comfortable in their own skin, so to speak. And so one of the first things we always try to do is tune up the skin, make the skin look as good as possible, because then people oftentimes are so happy with their skin that they don't feel like they need to sometimes even do surgery.
As you get older, your body you lose the collagen in your skin. Collagen's kind of like the springs in a mattress. You start to lose volume, and you'll start to notice fine lines and wrinkles. By stimulating the collagen, your skin will become firmer and the wrinkles will start to dissipate. There's several different things that we offer that help stimulate collagen, one of them being the Dermapen. It creates micro injuries to the skin, and when the skin starts to heal, it starts to rebuild collagen, which is pretty amazing.
And the goal is not to do surgery, the goal is just to make somebody look better.
I no longer have to search for makeups that cover up. I just feel younger than I thought I was going to feel in my 50s, and just feel brighter, and that my skin finally is at a place where it's glowing.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Diane has a question for Dr. Guy Lewis. What is the best way to get a whiter smile?
Well, there are a couple of ways to get a whiter smile. One way would be to bleach your teeth. Bleaching can work well for some people, but it doesn't work well for everyone. It just depends on the makeup of your teeth. So that's an easy way to try and see if it works for you. But for a more predictable result, and something that is going to be exactly like you want it to be, then doing veneers is the best way to do that. We can make them any color you want. We can change the shape, size, a lot of different things, but the color can be picked out and said, this is the color I want, and that's the color we can make them. With bleaching, you also have maintenance, whereas you bleach them up and they may not stay that color for very long. You may have to bleach them every 2 or 3 months to maintain that. So doing veneers, you do it, it's done. Doing the bleaching, more maintenance, but you can get a good result with the bleaching.
Get at least 7 hours of sleep a night. It will help you live longer, lower your stress, sharpen your memory, and reduce cravings for fattening foods.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility in Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility. This is the best doctor. And I truly believe that, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
For more information on this doctor, call now or go to bestdocsnetwork.com. Watch more videos on bestdocsnetwork.com.
And we welcome you inside the Best Docs Network studio. We are happy to be joined by Dr. Doug Wan. And when it comes to spine and neck surgery, this is your go-to doctor. He is also the director and founder of Spine Care. Dr. Wan, welcome to the program.
Thank you. Thank you for having me.
Let's start it off with your philosophy when it comes to your approach to medicine. What would that be?
So we practice medicine based on, our approach is very patient-centric, providing the best care for the patient. And when it comes to spine care, spine problems are a very complex issue. And so our approach is to approach it with a very comprehensive approach. So in our center, we have from the least invasive way to the most complex way of treating spine conditions. And we have providers such as chiropractors, physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeons. And we approach it through a multidisciplinary approach and find the best way to treat the patients so that they get the most amount of pain relief.
All right, doctor, what was your goal in creating Spine Care? What did you have in mind?
When we created Spine Care, our goal is to provide the best kind of spine care to the patients. There are many patients with a very complex spine problems. However, not everyone may need spine surgery, so we approach the spine through a multidisciplinary approach, and we find the best way to treat the patients with significant back pain. That's why we have from the chiropractor to physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeon. We find the right diagnosis and treat the patient the right way and the least invasive way possible so that they can get their life back as soon as possible. Also at the Spine Care, we have high-level imaging so that patients do not have to travel elsewhere to get their imaging studies done. Also, we have our own procedure centers on campus, so therefore they can not only get the evaluation, but also pain procedures done, as well as spine surgery.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
For more information on this doctor, call now or go to bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.